Welcome to the COVID-19 update for today, Monday, September 5, 2022. And as usual, we will be speaking with the Minister of Health, Dr. Frank Anthony, on COVID-19 here in Guyana.
Basically, Pfizer and Moderna would have created a new vaccine. It's called a bivalent vaccine. Bi meaning two. Right. So basically what they've done is to use the DNA from the ancestral strain of the virus and also from the current viruses, like the Omicron, and they have combined them so that you can get protection. Theoretically, the idea is that you will get protection from those previous strains plus the most current Omicron strain. So it has just gotten approval from the FDA, and CDC has also approved it. So in the United States, they would now be replacing their monovalent boosters with these bivalent boosters, and it should be more protective and give a wider coverage. So I think it's a positive thing that both Moderna and Pfizer has been able to create this type of vaccine, and it's a step in the right direction, creating a vaccine that would have such wide coverage.
And under our current arrangement that we have with the U.S. Embassy, are we likely to receive these kinds of vaccines in the near future?
Well, right now, there are limited supply even in the United States. So let's see once they have vaccinated their population, or at least a substantial part of their population, then maybe we might have access to this type of vaccine.
And so let's turn our attention briefly to the education system. School is open today, and we've seen our vaccination numbers kind of vary in terms of persons bringing out their children for vaccination. What is your advice to parents who have taken this wait-and-see approach as it relates to COVID-19 vaccination for their children?
Well, I don't know why people are reluctant right now, because initially when vaccines just came out, persons said that it's too early. Well, we have been using vaccines for quite some time now, and we know how these vaccines work. We know how it has been able to save a lot of lives, and so I don't know what they will wait and see. So the information is already out there, and therefore at this point in time we know that the vaccines are safe, it works, it's protective, and therefore we will urge everyone to make sure that they protect themselves.
Minister, apart from vaccination, what are some other steps that parents, teachers, children can take to ensure that they stay protected from contracting COVID-19?
So the first one is get vaccinated. Then the other measures really are more trying to have a barrier to prevent a person from getting infected. So these are what they call non-pharmaceutical methods. One, you wear a face mask. Two, you wash your hands and sanitize frequently. Three, to keep some distance from each other, because you don't know what the person next to you might have. And once you maintain these types of measures, then you should reduce the chances of getting infected. The difficulty, I think, comes in is that children generally don't keep their mask on, and those sort of things. So if they're not going to be keeping their mask on, staying a little distance from their friends, then the best way of really protecting them is giving them the vaccines, right? So even if they get infected, they would have a very, very mild form of the infection.
So talking a little bit about infection, can you tell us to date how many children have been diagnosed with COVID-19 so far?
So to date, for the 0 to 4 age category, we would have had 1,759 persons getting COVID. That's 890 males, 869 females. For the 5 to 9 age category, we had 2,251 cases, 1,164 males, 1,067 females. For the 10 to 14 age category, we had 2,870 cases. So we had 1,356 males and 1,554 females. So for the 5 to 11 age group, it's about 7.8%, first dose is 7.8% of that age cohort, which means that we have administered 7,964 doses of vaccines. The second dose, we're about 3.3% of that age cohort. So that means we have administered about 3,406 doses of the vaccine. For the 12 to 17 age group, we did 35,636 doses, or 48.9% of that age cohort. And for second dose, it's 26,132 doses, or approximately 35.8% of that age cohort.
This has been the COVID-19 update for today, September 5, 2022. For more information, feel free to visit the Ministry of Health's website or their Facebook page, or visit dpi.gov.gy for any other information. For DPI, I am Shukwan Gill.